Ray, a John Maxwell certified leadership coach. Welcome to Life, Love, and Leadership, where we discuss everything pertaining to life, love, and leadership. Let's get started. Welcome to Life, Love, and Leadership. I'm Tom Ray, and joining me on the line is my very special guest, Dr. Osama Imam. Doctor, can you say hello to everyone?
How you doing, everybody? Thank you for having me, Tom.
Yeah, absolutely. I'm so glad to have you today. And it's a really cool story of how we met, but we'll get into that in just a moment. Before we do, we'd like to start off the show with an attitude of gratitude. And today I'm thankful for family. I'm thankful for my family, and especially as we gather around the holidays, Thanksgiving and Christmas coming up, we're just so thankful. I'm just so thankful to have them in my life, and nothing's on this planet is more important to me besides my faith than my relationship with my family. And so I'm very thankful for that. And Dr. Osama, what are you thankful for today?
I'm thankful for my health. We tend to take that for granted until something bad happens. But every day I am thankful for my health and being able to do what I love to help other people get back to their full potential in their health. That's
what this whole podcast is probably going to be about, is talking about our health and how that can be better. So I had the wonderful privilege of meeting Dr. Osama back in, was it August?
So, yeah, August.
August, and had a wonderful time meeting him. We were at the Battle of the Bands event put on by Live Right Recovery Group, and they help people get off of addictions and things of that nature. And so my band, Omega Force, my band, we had been in retirement for probably the last 16 plus years. And I was there playing with another band called One With Him, and just decided, well, this is a wonderful opportunity just to bring my band out of retirement and play.
And now, Omega Force. Welcome to the war!
And so we got to rock out a little bit and blow the dust off of it. And we actually
did a good job.
Yeah, thank you. And we actually took second place. I can't believe it. We actually took second place. And here's the thing right here. Pretty cool. Did not expect that whatsoever. And there was certainly a lot of great talent there. And but in the midst of that, I got the pleasure of meeting you, Dr. Osama, and I'm just very thankful for that. So why don't you bring us up to speed and just tell us who Dr. Osama is?
So I am a physical therapist. I'm born and raised in Southeast Michigan. I went to school here. I went to my undergrad at Oakland University and then finished my doctorate in physical therapy at Wayne State University. And once I was done with physical therapy school, I didn't really feel like they taught us enough to help patients. They more taught us how to not hurt a patient and how to pass our board exam. So I wanted to really go out into the field and be able to get people better. So I chose to continue my education, and I did a fellowship in orthopedic manual physical therapy. So that was another 18 months after finishing physical therapy school. And it was a distance-based fellowship. So it required a lot of travel last year. And I'm thankful that my wife was very supportive throughout all of this. And I was certified in dry needling and spinal manipulation through my fellowship. But being a fellowship trained physical therapist, our goal is really to have a better understanding of how to diagnose a patient in order to get them better sooner And based on research, we are able to get patients more superior outcomes. And that is why I chose to do a fellowship and I skipped a residency. And I've been done with that for actually about August is when I finished, and I officially walked the stage and graduated in late October. So I've been doing, thank you, I appreciate that. So I've been a physical therapist for about 2 years now, and it's honestly the best job I think I could possibly have. I feel like we can problem solve a lot. We can help a lot of people get off of medications, avoid unnecessary surgeries. We can reduce healthcare costs. So it really is it's an honor. Aside from being a physical therapist, I'm a family man. Just had my first baby about almost 4 months ago. I have an incredible wife. I would not be able to do anything without her. And I'm very close to my family, my parents, my grandmother, and my siblings. So if I'm not working on my business, I'm typically spending time with my family or trying to increase knowledge in some way, whether I'm reading research or I'm reading a book. I'm trying to learn as much as I can so that way I can help more people. That is my ultimate goal.
Oh, that's wonderful. So there's a couple of questions in that. So one is how's your life changed since the new baby arrived?
I definitely want to work harder to support my baby while being strategic as to how I schedule my day so I can spend time with my baby. So since we met actually at that Battle of the Bands, I was with the previous employer, and I have since left that position as a director of a clinic, mainly because I was spending too much time out of the house. So I would be leaving early in the morning, driving about an hour to get to the clinic where I was working. I would work a 12 to 13 hour day and then get home late at night. And on those days, I would miss the entire day with my child. And I would have other days off, but typically on those days off, I was busy catching up on things because the days that I worked, I was inside of a building all day long. So I found that soon after my child was born, this is not how I wanted to work. I want to be more present for my kid and be able at least to maybe spread out my days, control my own schedule. If I need a time off, I could take time off. And that has been my goal. So since having a kid, I'm much more strategic as to how I go about my day to make sure that I'm available for my kid and available to help my wife. A lot of this falls on my wife. She does the majority of the work. And God bless our mothers, because it is incredible to see what they go through from a firsthand perspective. Obviously, I don't remember my mother taking care of all of us when we were that young. So to see all this, I've gone back to my mom and thanked her for everything because I see how hard my wife works.
Yeah.
So it has definitely changed my life, and I want to make sure that I'm able to pass on good values and skills and ethics to my son. And that is why I do what I do. The goal really is to help the future generation.
Mm-hmm.
The next generation scares me a little bit. So I want to make sure that I'm putting somebody into the world that can help make the world a better place. And do my best every single day. I'm just trying to get a little bit better.
That's wonderful. And I'm glad that you're aware of that, because sometimes it takes us knuckleheads a little while longer to figure out that very important thing is family. You know, as the saying goes, I think I wrote it in my book. I have a book called A Married Man's Handbook. When I said I do, I meant it. And in the book, I say that no man lays on his deathbed saying, I wish I would have worked more. You know, and so that's wonderful. And so let's talk about your wife real quick. Where did you meet this superhero?
My wife and my sister were friends. So my sister brought this girl over, met her about over 7 years ago now. Almost to the day, actually. It was right after Thanksgiving. My sister brought this girl over, and I was taken aback when I saw her. And after a few months, I couldn't get this girl out of my head, and I asked my sister, like, you have to invite her over again. And she did, and I expressed my interest. We talked for quite a while after that. Got engaged about a year and a bit later, and we've been married now for just over 4 years.
Awesome.
And my kid is almost 4 months now. So I was finishing up physical therapy school actually at the time when I first got married. So I went through all of that, got married, waited another couple of years, and then we had our first kid, thankfully.
Wow.
Yeah.
There's a lot going on in your household, huh? That's wonderful.
It's fun. It's
Yeah,
a lot of fun.
I'm sure it is.
Yeah.
I'm sure it is. There's a lot of firsts,
Yeah.
as you would say, and I'm sure, as you were talking just a moment ago about being there, so to hopefully see the first steps and to hear the first words, which is going to be mom or dad.
I think they usually say that the baby says dad first, and moms don't love that. That's what they say. I don't know. I'll find out. I'll let you know.
Yeah, let us know. Let us know so we can let our listeners know. But that would be wonderful to hear that. So what's the difference between fellowship and residency?
So with a residency, it's typically going through a university or a big hospital system. So like the University of Michigan has residencies, and there's a lot of different residencies you can do. There's orthopedics, there's neuro, there's acute care, cardiopulmonary. So there's a lot of different residencies that somebody can do, and they usually go through bigger hospital systems or a university. Fellowships don't necessarily have to go through them. There are some fellowships that go through residencies. Excuse me, there are some fellowships that go through hospitals or universities. My fellowship was through an academy, so it's the American Academy of Manipulative Therapy, and the difference is that it's a bit more in depth on the clinical aspect of things. And in residencies, they definitely focus on that as well. You have a mentor, whether you're in a residency or a fellowship. I find that a lot of people that did the fellowship usually go through a residency first. That's not always the case, as I didn't do a residency, but they tend to teach you at a little bit of a higher clinical level because they're expecting people to already have that foundational knowledge. Most residencies people will be doing immediately after school. That's not always the case. You can go out into practice and come back and do a residency 20, 30 years later. That's even a possibility. But what I found with the fellowship is that it's a little bit more in depth on the clinical aspect of things. And we also had to do some research. In both residencies and fellowships, you're reading a ton of research. You want to understand why we are doing what we are doing with patients. And both of them are intended to improve outcomes for our patient. But based on this one research study is that fellowship trained physical therapists do have better outcomes. Have you ever been in physical therapy, Tom?
Just chiropractic.
Okay. So in physical therapy, typically you'll go in and fill out what's called an outcome measure, which is a questionnaire based on your function. So for neck pain, do you get headaches? Does it limit your concentration? Do you take pain medication for it? Is it limiting your sleep, your ability to drive? All these types of questions that are based off of your function. And what we've seen in the research is that those that have done a fellowship will have better outcomes on those outcome measures. So by the time a patient is being discharged, the patient is actually doing better than they would if they saw a non-fellowship trained physical therapist. And that was my intention for why I did a fellowship, because the reason I do it is to help the patients in front of me. I want to help them get better. And then ideally one day maybe I'll be in a leadership, an academic position, maybe teaching. And I'm hoping that will also help me get there one day.
That's good. That's good. So, what is, describe to us a little more what you do. And maybe with that, share with us who is the ideal patient.
Okay. So I'm also what is called an osteopractor. That is a subspecialty within physical therapy. It's part of my fellowship. So while doing the fellowship, I also obtained my osteopractic diploma. And the focus with that is spinal manipulation, dry needling, instrument-assisted soft tissue mobilizations, and diagnosis. So the way that I treat compared to physical therapy, and you've never attended it, so let me break it down for you a little bit. A lot of people that go to physical therapy, unfortunately, will get put through a lot of exercises that may not be specific to that patient's condition, get put on a hot pack or a cold pack, get some electrical stimulation, and that's about it. They very rarely get manual therapies, depending on the practice. Everywhere is a little bit different, but in the grand scheme of things, this is kind of how physical therapy has become. And a lot of the reasoning for that is the reimbursement rates from insurance companies. So manual therapy does not reimburse as well as, say, therapeutic exercise or neuromuscular re-education or therapeutic activities. Those last three, therapeutic exercise, therapeutic activities, and neuromuscular re-education, are just different types of exercises, just depending on why we are doing what we are doing. So exercise maybe just to strengthen a specific muscle group. Neuromuscular re-education typically can be dealing with some balance. It's more of that mind-body connection, getting them to be more aware of their body, while therapeutic activities is things that are directly functional, like a sit to stand, practicing standing up, sitting down, or what would be called a hip hinge or a deadlift, because that's picking something up off the ground. So they're directly related to a function. Those three reimburse better than manual therapy does. But the problem with that is if I go put somebody on a treadmill for 10 or 15 minutes, that makes more money for my company than if I were to do manual therapy like spinal manipulation, dry needling, which in my opinion requires a bit more skill than just putting somebody on a treadmill for 15 minutes.
Mm-hmm.
Now, I think exercise can be heavily skilled, and I love exercise. I prescribe exercise for my patients, but the way that I treat is not an insurance-based model. And the reasoning for that is, and you had spoken to a couple of private pay physicians on your podcast before, and my model is pretty similar to theirs. I want to make sure that I'm spending time with my patients to give them optimal outcomes. And a lot of people ask me if that costs more on the patient, because if they're paying cash for a session, then it's coming out of their pocket. But the thing is, people don't really understand insurances then, because if you have not met your deductible, you're going to get all the bills anyways. So for example, this year, we've been paying $250 for our healthcare, along with my employer in the past was covering another $250. So it was a $500 a month healthcare plan for me and my wife. That was our premium. Our deductible was $4,000. So that means that our insurance does not cover anything at all until we meet $4,000. Sometimes they'll cover like a physical, maybe your first eye exam, like some preventative things. But for the most part, they don't really cover anything. So every time that my wife went to the OBGYN, we would get a bill for that. If she went to physical therapy, I sent her to a women's health specialist. Women's health is not my specialty. Every time she would go to physical therapy, we would get a bill for that. And that's because we did not meet our deductible. Once we met that $4,000 deductible, then they started to cover everything. And we had a pretty good healthcare plan. A lot of people have higher insurance deductibles than that. I've heard of everything from $10,000 to $17,000. Now, if you're in decent shape, it's highly unlikely that you're going to meet a $10,000 deductible. The nice thing about having insurance, and why I think it is necessary to have healthcare in the United States, is if God forbid something happens and you end up in the emergency department, then you won't go absolutely bankrupt because you have that insurance to cover you. But if you're going for let's say, for example, my shoulder is bothering me, and I go into a physical therapy practice and they're billing my insurance, one, it's a lot of hidden bills. If you call any physical therapy practice right now and ask them, what is this going to cost me? They're going to tell you they don't really know. It depends on what the physical therapist bills, depends on what they do every single session. And then you might get your bill a month or so later, and you're going to have every single session almost costs a different amount of money, where you'll have one that's maybe $200, one is $120, and then everything in between. Some of them are even more than that, depending on how long you're there. So the way that I practice is based on what the patient is dealing with. I spend a full hour at least with every single patient. It is focused on manual therapy. They come in, I do something to make them feel better, re-educate them as to how to move around. I will give them exercises that they will do, and they are more invested in it for that reason as well. And also, they're not coming in to waste their time. They're not going to come in and spend 15 minutes on a treadmill and then me having to do a bunch of other exercises because that makes more money for the company. And then I do very little manual therapy because that doesn't make as much money for the company. The way that I practice is based off of how I can help the patient the best. And they will often save money for that reason, because I can get them better in less sessions. If you go to a physical therapy practice that's giving you very generic exercises for back pain, it might take you 10 to 20 sessions, if not more, to get better. While if somebody comes in to see me and I have, one, superior outcomes with patients, but also I'm spending more time with them. I'm taking a deeper look at what their dysfunction is, and then I treat them. Ideally, I can get them better in less than 10 sessions, maybe in 5 sessions, for example. So it might cost more per session, but overall it's less costs. And I'm also very, very truthful. I'm honest with my patients. I let them know what they need. If I feel like I have done my part with them and now they maybe need to go see a skilled personal trainer that understands the body really well, I'm expanding my network. So that way I know where to send my patients depending on their area. So that way I can limit costs for them and get them better as quickly as possible. That all makes sense.
Yeah, absolutely. Absolutely does. And so what typical things do you treat more often than others?
I treat a lot of headaches. I did a research study while I was in my fellowship on headaches. So it seems like a lot of people now know me for treating headaches. But ideally, I love treating headaches, neck pain, back pain, and elbow pain. I treat a lot of tennis players and pickleball players.
Hmm.
And oftentimes they have shoulder, elbow, and wrist issues. So I see a lot of that. A lot of them have back issues as well. But really, I treat everything under the sun. If they have a musculoskeletal condition, I am trained in how to treat it. And if I'm not, I let them know. And that's why I have, like yesterday, I met with another woman's health specialist. I've had 2 female patients come see me for a pelvic dysfunction. I don't treat pelvic floor issues. So I will be honest with them. I'll sit them down, have a conversation with them. Like if they're having something associated with it, maybe some back issues, I might try to treat that 1 or 2 sessions, but I'll let them know for this pelvic issue, I'm going to refer you out. This is a list of the people that I trust in your area that can treat you. So my focus is really on more of those really common issues that we deal with in America. I mean, 8 out of 10 people deal with back pain at some point in their life. It is the leading cause of disability in the United States. So that is one of the things that I love treating the most. And the way that I treat it works really well for it. Like you said, you've been to a chiropractor. I specialize in spinal manipulation. So I do adjustments similar to how chiropractors do. Some of them are exactly the same as chiropractors. Some of them are a little bit different. And we all have our own specialties and our reasons for doing things. But that is one thing that I often will do for those that have low back pain. Same with neck pain, headaches. But I also do extremity manipulation. Another thing that I do is dry needling. Dry needling is like magic. Same needles as acupuncture, but the technique is a bit different. In acupuncture, they're trying to move qi or energy across meridians, and it's based off of a traditional Chinese diagnosis. That is not what I'm attempting to do. I do dry needling for the reason of creating small trauma in the body so it can come heal itself, so we can promote more blood flow to the area. We can signal for the body to produce its own opioids. I'm actually reading a study for probably the 6th time now, because this is a complicated study on the mechanisms of dry needling. Like this has been my focus over the past week or so, because I want to continue to understand it better and better. So I've taken dry needling courses. I've probably taken over 10 dry needling courses now, because I want to continue to get better at it because of how well it works. And while I know what conditions I can use it for, I want to understand it at a deeper level more and more. Another thing that I do is body tempering, which I will often use for really low back pain is the thing I would say I use it most often for. Body tempering is essentially, think of a metal foam roller. It's about a 2-foot metal cylinder, and it weighs a lot. I have everything from a 25-pounder to an 80-pounder. And depending on the area that I'm working on, it kind of feels like a deep tissue massage. I will use it on the back. So the one that I have has a little bit of like a divot in the middle, so I can go right over the spine and not really compress the spine. I'm just going on the muscles surrounding it. But some of the other ones that I have a capped end, so I can get into the glutes, into the upper trap. Sometimes I'll do the forearm with it, or the calves and hamstrings. But body tempering was designed by a bodybuilder. His name is Donnie Thompson. And Donnie Thompson is the first Mr. 3000 in the world. So between deadlift, bench press, and squats, he put up 3,000 pounds, and he is a giant of a man. Lovely human being. I met him down in South Carolina. He invited us over to his home, so we got to see how he came up with body tempering, who he's used it for. We got to learn techniques directly from him, and we got to see his home gym, which was really cool. He's done it for a few of the NFL football teams. So like the Philadelphia Eagles, the year that they won the Super Bowl, Donnie Thompson was body tempering the team that year. I saw this past year, although the Cincinnati Bengals lost in the Super Bowl, I saw right before the Super Bowl that they were getting body tempered. So it's kind of picked up in professional athletes. It's not really in the rehab world yet, but it's because it's only been around since 2014. It's only been 8 years. And it takes quite a while for science to catch up. So if you look up any scholarly reviewed article on body tempering, there's only about 3 that you'll find online. But I do think that that is going to increase in the future. One thing that I pride myself on is that I practice in an evidence-based manner. So what I do is based off of research. But what we forget about is that evidence-based practice is 3 pillars. It is the clinical experience, the patient expectations, and research. So from my experience, body tempering works incredibly well. Patient expectations, patients will come in asking for it, or they've heard about it and they want to try it out. And oftentimes it works really well with that reasoning. And I think the research will catch up with time. But there's also a concept of mechanotransduction, which is how exercise works. If you create a trauma by exercising, the body will adapt and get stronger. With body tempering, we're creating a trauma in a different manner, but the body will have to adapt. We can decrease muscle tone, improve muscle length, and it works incredibly well for that. A couple of the other things that I do are cupping, which is oftentimes people have seen this based off of Michael Phelps in the 2008 Olympics, where he had the bruises all over his shoulder. And it's picked up a lot in sports as well. But it is I think I have my cups right here, actually. Yeah, I have a set of cups. So it's it's a negative pressure where we can lift the tissue. It's been in practice in Chinese medicine for thousands of years, and they would do it in the past with fire that they'd put underneath the cup, create a negative pressure, and be able to suck up the tissue. The way that we do it now is different. Some people still do fire cupping, but we just use like a suction gun, which I like because we can control the pressure a bit more. And then I also do dynamic cupping. It's similar concept. It's just a silicone cup, so we don't really get as much of a suction, but I can target a larger area because I'm moving the cup around the whole time. We just put some sort of a lubricant, like a lotion or something, so I can maybe target the entire back. Those are both ways to promote more blood flow. One reason that I cup often with the static cups, the ones that leave the bruises, is typically for a nerve dysfunction. So oftentimes you'll see somebody go in and get cupping done if they have shoulder pain, for example. The provider will just put a bunch of cups on their shoulder. I don't really cup like that. I don't find that to be as beneficial. I will cup more for a nerve issue, and there are studies to support this, where if we're suspecting a nerve entrapment, we can put a cup over that nerve to traction it, create a different input. Usually, everything that we do is pressing. We're adding more and more pressure. Someone goes and gets a massage, and they want more pressure. Rarely do we do the exact opposite of that, where we're creating we're pulling the tissues away, so we can promote more blood flow, release the fascia, get more blood flow to that nerve, but then we can also move that nerve to improve nerve conduction velocity. So we're just trying to improve how the body is moving without the use of any other medication or anything of that sort. Because every medication that we give has a side effect, and the way we treat that side effect is adjust the dose or give them another medication. And I think we're starting to get away from that in healthcare, thankfully. There's a lot of things that we can help with that are not known. But my mother is a physician, and she didn't know until I was in physical therapy school that we can treat vertigo. If somebody has dizziness, you can send them to a physical therapist. My mom, as a primary care, didn't even know that because they didn't talk about that in her medical school or in her residency. Granted, my mother went to school quite a while ago, but there's so much for physicians to know. It is incredible what they do and how much they can help with. But I think some things, either those that are teaching, that are in the classrooms, may have not been in the clinic in a long time. That's how it was when I was in physical therapy school. It's a lot of our professors that haven't been in the clinic in years. And I believe that would be the case in all academia, and that's how it would be in medical school as well. And ideally, you would hope that they would learn some of these things in their residencies. But again, there is so much for physicians to know that they don't really focus on, I think, their referral aspect of things. Now, when something is not going as planned with one of my patients, I know that I have to refer them out. I have to find the right provider for them to go see to make sure this patient is improving. And I think a lot of this is the fault of my profession as physical therapists. We don't often go out and tell people what we are able to help with. When I tell people I treat headaches, they get surprised. But you've seen a chiropractor. They do a fantastic job of marketing that they can treat headaches. And the way that we treat it is getting people off of medications through our manual treatments, through exercise, So there's a lot that we can do, that we just need to start getting our voices out there. That's why I appreciate you allowing me on your podcast.
Yeah.
Hopefully we can spread the word and help more people this way.
Yeah. Just like my interview with Dr. Blanchard, that direct primary care philosophy, I don't think a lot of people know about it. And just like with you and all the things you've talked about, and cupping and needling and all these different things, I'm not sure how many people actually know about a lot of that stuff. And to go back a little bit, my wife dealt with frozen shoulder. She had actually surgery done, and she had to go through therapy. She had to sit in our house in a chair that would raise her arm and lower it, and raise her arm and lower it, all day,
Mm-hmm.
and that was the physical therapy kind of thing going on in the home. And then, of course, she was going in a sports clinic to get more physical therapy. But so that's powerful. You're dealing with headaches and shoulder pains and things of that nature. And there was one other thing you mentioned, opioid. So what was that you said that you pull it out of the body or something? What is that about? I've never heard that before.
So when we insert a dry needle, there's a couple of different things that are happening where the body will release opioids. So, for example, there's keratinocytes, which is skin cells. They make their own opioids. They've done studies where they've shown that when you insert a needle, you're promoting more opioids. And then if they give an opioid blocker, the patient doesn't get as much pain relief anymore. They've done these studies in mice and in humans. So we know that there is an opioid mechanism that is happening with dry needling. There's an area in the brain called the 𝙇𝙤𝙙𝙬, which will stimulate the release of opioids when we insert a needle. And it's essentially part of the body's natural healing mechanism. We've heard of endogenous opioids in things like exercise. Like if somebody goes on exercises, your body releases endorphins and endogenous opioids. We get that effect with needling as well. So there's a lot that we can help with. And people that come in and say, I don't want to take medication, it doesn't make me feel like myself, they typically love needling more than other patients because it gives them that pain relief, and they feel like they don't need to take their medication as much anymore.
That's good. So is there a difference between the opioids that we produce and those that are drugs that, the opioid thing that's sweeping the nation or whatever? Is there a difference between the two, or
I'm not sure exactly the differences. I don't fully understand the differences between the pharmacological opioids and our endogenous opioids that our body produces, but I would much rather have something that my body makes than something that is synthetic that I'm putting into my body. Yeah. I would rather not take medication as long as I can. And it's incredible because we have found ways to heal people for thousands of years, but over the past 100 years, it has been truly, we give somebody a drug or we cut them open and do a surgery. And I feel like there should be a better solution than those two things. And honestly, I think what I do is one of those solutions. Those are necessary. I think medications are definitely necessary for a lot of patients, and surgeries are necessary for a lot of patients, but that should not be our go-to. We should try all conservative measures first. It's been very common that I have seen patients that have had a joint replacement or a fusion. They've had surgeries that they regret getting in their life because they're in more pain or worse shape than before. And the thing that's most sad about that is they didn't try conservative measures first, and you cannot uncut someone. Yeah. So my grandmother has had 2 knee replacements. She had those knee replacements about 15 to 20 years ago. I was a kid when she had her knees replaced. But they only last about 15 to 20 years. I think they do a bit better now. Maybe they last a little bit longer. But 15 to 20 years is how long a joint replacement lasts. So her knees started to hurt her again as she's reached her late 70s now. And the problem with that is they could go in and do another surgery, but her heart can't take anesthesia as well as it could 15 to 20 years ago. And at that time, they had not tried all conservative measures. Now, physical therapy has been developing a lot over the past few years. Dry needling, I don't think was anything that people even thought of back then. But they still could have tried general physical therapy, general strengthening, balance training. They could put somebody when they reach Medicare age, at least in physical therapy to help improve their balance, so they're less likely to have a fall, less likely to have pain later in life. And then we were reducing a lot of healthcare costs. The really scary thigh about aging is fall risk.
Yeah.
And my grandmother had a fall last year, and she broke her femur, which is the thigh bone right above her knee. And she also broke her shoulder. So they had to do a reverse total shoulder replacement, and they had to do a surgery in her leg where they essentially put a plate and screws. They wanted to put a rod in, but she had a previous knee replacement, so they couldn't do that. So then she was not weight bearing for, it took them about 3 weeks to do the surgery. So it was about 4 months. She could not put any weight on her leg. And then after that, we had to work her back up to be able to start walking again. She's a champ. It has been inspirational to see. She's walking around with a walker now. She can do some stairs, but she gets really, really fatigued because there were 4 months in her old age where she was not putting any weight on her legs. And all of that, I think, could have been avoided if, let's say, 12 years ago, they put her in physical therapy, had her work on her balance to prevent that fall from happening. And if you do physical therapy for 20 sessions, it might cost $2,000 12 years ago. Her going to a hospital, there's ambulance ride, ER visit, multiple providers that have to come see her because of all of her comorbidities. And then they had to do multiple surgeries, multiple follow-up visits, and then physical therapy in the end anyways. It ends up costing almost $1 million in healthcare costs. And all that could, I think, have been avoided, if not prolonged, if we worked on fall risk before somebody's a fall risk, when they first reach Medicare age. And all of that can also help with the opioid use. I mean, they put her on opioids since I was a kid. It was really common back then. Thankfully, they're prescribing opioids less, but there's still deaths going up from drug overdose.
Right.
If people aren't getting their opioids, they look for it elsewhere. And I think that we have done a decent job in trying to reverse the effects of the opioid epidemic, but there's still a lot of work to be done. These people, they need help.
Yeah. On that note, I've probably lost 5 people, I think, close to me that have died of drug overdoses.
I'm sorry to hear that.
And so, being there at the Live Right Battle of the Bands event was especially near and dear to my heart because, it's also about, helping people get recovery. We've done some podcasts here on mental health. And so a lot of those things drive people to, to use and abuse. And, there's a lot of people too, I've told my kids as they grew up is that, nobody sets out, I'm going to be an alcoholic when I get older, or I'm going to be a drug addict. Nobody says that, but they start with these things. And one thing leads to the other and so forth and so on. And so my encouragement to my kids was just never to start, never to partake in it, because if it does become an addiction, it's hard. It's a monkey that's hard to get off your back. And so this is wonderful what you've been sharing today. And it was a pleasure of mine to be able to meet you back at the Battle of Bands event and just to hear your heart and to hear how you have a heart for your patients. And I appreciate that about you. And you can speak into that if you want real quick. But what I'd like you to do is tell us where are you at now and how can people contact you?
So I now have a mobile concierge physical therapy practice. So I go to people's homes. I bring all of my gear with me. I go to homes or workplaces to treat patients. So I make it as convenient as possible for the patient, where they don't have to worry about leaving their home, going into a crowded clinic. They're in the comfort of their own home, and I come to them. I treat my patients on, there are no hidden costs. So they pay the one fee, mm-hmm. and they get everything that I offer underneath that. So I will do whatever they will benefit most from, whatever they feel like they are benefiting the most from. And by doing that, they get better faster. So the way that people can contact me is through my Instagram, The Dynamic Physio, or they can contact me on my cell phone. And I schedule everybody myself and basically try to set up in a way that I'm only seeing patients ideally one time a week. Mm-hmm. If you go into a physical therapy practice, usually 2 to 3 times a week, which I think can be overkill at times. So I'll see them for one time a week for that entire hour, and usually I go a little bit over that. But yeah, I'm in the Southeast Michigan area. I go all over. Wherever people need help, just give me a call. We'll make something work.
Yeah. What's your drive radius roughly?
Furthest I've driven for a patient so far has been an hour.
Okay.
Yeah, most of my patients are usually within a half-hour drive, but I do have some that are a bit further.
Okay. That's great. And you mentioned your cell number. Would you like to give that out?
Yeah, it's fine. 248-469-7841. And I'm sure we'll put it in the description.
Yeah, absolutely. We will definitely put your information in the description where people can just click and away they go. And Instagram is another way to connect with you, or do you have a website or anything like that?
I'm in the middle of building the website right now. It'll be up on my Instagram once it's built, but we're still in the middle of building that right now.
Okay, great. Yeah, because you're in new territory right now, right? Because you stepped away from the place that you were at 4 months ago.
And people don't often do mobile physical therapy like this. Like if you were to get physical therapy at home, the only way that insurance covers that is if somebody is homebound where they're unable to leave their home. So I go to people's houses and do orthopedic care. Home care physical therapy is a lot more of working on function within the home, making sure they can get in and out of their house, going up and down stairs. We still will treat pain and things of that nature while doing home care. But usually if someone gets directly home care physical therapy through their insurance, they're unable to, if they're even able to leave their house for work. So the way that I do it is I'm treating typically working people. Some of my patients are retired too, but it's all care in the comfort of their own home, and it's orthopedic care typically.
That's interesting. So this has been very educational. One more thing, you did mention vertigo. Now, my wife has dealt with vertigo quite a bit. So can you speak into that just for a quick second?
So with vertigo, we want to make sure that it's actually coming from the inner ear and not coming elsewhere. It could be coming centrally, but there are a few different things that can cause dizziness. So we want to make sure that we do first a good job diagnosing them. And I have a really good ENT physician that I work with who specializes in ears. So because dizziness can get difficult at times. If it's not true vertigo, it can be pretty difficult. And usually he's the physician that I refer to because of how much I trust his care. But if it's an inner ear issue, it's typically 2-3 sessions and they get better. And they may come back in the future, but then they know who to call. They come in maybe 1, maybe 2 more sessions and they're better again. And it really does happen that quickly. But there's a few different maneuvers that we can do depending on how comfortable the patient is in these positions. Like some people can get comfortable on their back. And for one of the maneuvers, we do it while somebody's lying on their back and they have to roll around a bit. So there's a few different ways that we can treat it. But all of it is the same idea where there's these crystals in the ear that get dislodged. These crystals are how we have an understanding of where neutral is. And that's why if your eyes are closed in a car, you can feel when the car is turning. So what will end up happening is it feels like they are moving. It feels like the room is spinning, but they're completely still. So sometimes you'll see them like start to kind of like shift. They feel like everything around them is spinning when surely it's also coming from the inside of their ear. So we can attempt to treat it. Thankfully, it's a low risk thing to treat. So we just make sure we rule out any red flags. We can attempt it. If they don't improve, then we often we say in physical therapy, everything is a trial treatment. So if it doesn't work, you do something else. So if they don't get better relatively quickly with vertigo, I often will be referring them out just to make sure that I'm not missing anything, because I have to recognize that I don't know everything. So I could be missing something that is more under the scope of a physician's practice. So that's why I refer them out. But yeah, if it is true vertigo, typically treated relatively quickly.
Great. In the Christmas season that we're in, I just got to watch Miracle on 34th Street last night with my wife, and in the movie, the Santa Claus begins to send people to other stores to find what they're looking for. And so making them the one-stop shop, you come here to Macy's and we're going to help you go wherever you need to go to get whatever you need to get. And likewise, from what it sounds like you've been sharing is that you can be that kind of resource. Start with me, and if I can't help you, I'll refer you to somebody else that can help you and make a difference in your life. Does that sound about right?
Yeah, that's the goal. We actually don't even need a referral, like a physician script in Michigan anymore for physical therapy. So it's all 50 states. We have something called direct access, and some states are more limiting than others. So in Michigan, we can see a patient for 21 days without a referral from a physician. So I can treat somebody for 21 days. And then if they are improving, I send them back to their physician, get a script, and we can continue care. Some states are completely open, like Arizona, I think Wyoming, completely wide open, direct access. So they can see patients indefinitely. If they are showing improvements, they can see patients indefinitely, essentially. And then some other states, you can only maybe do the evaluation or a few sessions, but you don't even need a referral to come see a physical therapist. So the goal is that if somebody has some sort of a pain, that they go see a physical therapist first. Physical therapist can direct them as to where to go. So that way we're not doing unnecessary x-rays or MRIs and increasing healthcare costs. We can make it as inexpensive for the patient as possible while also improving outcomes and improving quality of life.
That's wonderful. Well, one last thing is there anything you'd like people to know about their health or otherwise?
I think that we need to take more control of our health. You don't need to listen to one provider only. I think every provider should be open to secondary opinions. So if you go see a provider and they are recommending a surgery or anything of that sort, I would recommend maybe asking another provider. You can let them know, hey, I'm only here for a second opinion. I'm not looking to get anything done by you. I just want to make sure that what the other person is telling me is accurate. I think we need to do our own research on the people that we are seeing. That doesn't necessarily mean go, on Dr. Google and look up everything that's happening, because they'll usually give you the worst answer possible on Google. But I think it is important to take control of our healthcare. It's a world full of information now. So you can very easily find providers in your area if you go on Google and find somebody that you trust, has good ratings, and you typically would like as a person, like you like their personality. It's not always the case. If I need somebody to save my life, I don't care if they're a good person. I want them to save my life. But typically you can find out if somebody is the right provider for you, and don't do something if you don't feel comfortable with it. That is the main thing I would want people to take away. There's many different ways to treat things.
That's good.
Yeah.
Thank you so much. Like I said earlier, this has been very educational, and the opportunity to get to know you better. And again, everyone, I had the opportunity to meet Dr. Osama back in August, and he just resonated with me and his story. And it was such a pleasure to meet him. So is there anything else you'd like to share before we wrap up?
That's everything that I have. I appreciate you for having me, Tom. Thank you so much.
Absolutely.
Yeah.
Absolutely. And again, if you'd like to contact him for any physical therapy of any kind, or whatever, just, headaches, shoulder pains, whatever you got going on, contact him first and see what he has to say. Maybe he can help you. We'll put all of his information in the description of this podcast. Please take the time to subscribe to the podcast, as well as share it with others. And we'd love to hear your feedback. You can send your feedback to tom@realleadershipcompany.com. And also, if you need any leadership development and or coaching, group coaching and or motivational speaking, you can certainly contact me again at tom@realleadershipcompany.com. And I'm also a realtor. So if you need to buy a home or sell a home or business, please contact me at TomReaRealtor@gmail.com. TomReaRealtor@gmail.com. And with that does it for this edition of Life, Love, and Leadership. Thanks for joining us today.